So atrial fibrillation is a rhythm problem of the heart that makes the heart go fast and irregular. The main symptoms for atrial fibrillation is basically palpitations. Some patients feel shortness of breath with their palpitations, and sometimes dizziness and feeling tired in general. And on some occasions also atrial fibrillation is asymptomatic if it's not making the heart go very fast. So there are several types of atrial fibrillation too. The Heart Rhythm Society classifies atrial fibrillation into three main streams. One is what we call paroxysmal atrial fibrillation. It's atrial fibrillation that comes and goes. You would feel several episodes a day, but you would break out of them in between. The persistent one is the one that lasts more than a day or so. And when we try to take the patient out of it, sometimes the patient comes back in atrial fibrillation again. So it kind of needs an intervention to take the patient out of atrial fibrillation. The third one is called chronic. Chronic meaning the atrial fibrillation has lasted very long time. And some patients come to us with atrial fibrillation for years, and usually those are a little bit harder to take out of atrial fibrillation. The atrial fibrillation has several etiologies or reasons or causes. The main cause is heart failure, and patients who have low heart function, causing them to have scar in the upper chambers of the heart, and that scar is the origin of atrial fibrillation. Also, the other main cause of atrial fibrillation is genetic. Sometimes it runs in families, and patients will have a normal heart but have the atrial fibrillation. We call it lone atrial fibrillation. The way we treat atrial fibrillation, it mainly consists of three main arms. One is controlling the heart rate, which is preventing patients' hearts of going too fast when they are in atrial fibrillation. Those drugs are designed to slow down the heart when the patient is in atrial fibrillation. The second arm of therapy is preventing the patient from having a stroke, so stroke prevention. Stroke prevention is accomplished with mainly Coumadin. It's a blood thinner. We basically thin the blood in order for the upper chambers not to form any clots in them. And the third therapy is what we call antiarrhythmic therapy. It's different than the first arm of therapy. The first arm, we were preventing somebody from going too fast when they are in atrial fibrillation. This arm of therapy is preventing patients from going into atrial fibrillation in the first place. And it consists of drugs and a procedure. Atrial fibrillation ablation is a procedure that has been shown to decrease the recurrence of atrial fibrillation when compared to medical therapy, when compared to the regular drugs that we use. Hence, it was adopted as, currently it's adopted as a second line and sometimes first line therapy in certain situations. What we do in atrial fibrillation is we found that in about 70% of the cases, roughly, there are foci in the upper chamber of the heart, the left upper chamber of the heart, that makes the electrical current in the upper chamber disorganized. And we target those. Usually those are the veins that bring the blood from the lungs to the heart. The procedure consists of doing a line or a freeze depending on the technique. So sometimes we freeze around the veins, and sometimes we do radiofrequency ablation, meaning heat, using heat to kill the cells around the pulmonary veins, the veins that bring the blood to the heart. And we isolate those veins electrically from the heart. Hence, it makes the heart less likely to go into atrial fibrillation. We consider this therapy mainly for patients who are already on medications. They tried medications and it did not work for them, or they do not like to be on long-term therapy because of side effects. The atrial fibrillation program at the university has been present and established for a long time. We've had operators for the last 10 years at least who have been taking care of atrial fibrillation. In the beginning, before we had the ablation therapy, it was mainly treated conservatively with medications. But when ablation therapy came about, the program here obviously took that and launched the program, the atrial fibrillation program, and We've had a large number of patients who came in through the last several years, actually, coming for ablation therapy.